Hello, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the topic joints. So first is, what is joint? Joint is a junction between two or more bones or cartilages. And with the help of joint, it helps to do movement in the body. And immovable joints are primarily meant for growth and may permit molding during childbirth. And there are more joint present in the child as compared to adults, because as growth occurs, some bone fuses together. And these are the example of the bones that become fused. For example, first is ilium, ischium and pubis fuse and form a pelvic bone. Two halves of the frontal bone, mandible, five sacral vertebra, four coccygeal vertebra. Next is the classification of joints. So first classification is structural classification. According to this, joints are of three types: fibrous joint, cartilaginous joint and synovial joint. And further, fibrous joint are of three types: suture, syndesmosis, gomphosis. And cartilaginous joint are two types: primary cartilaginous joint, which is also known as synchondrosis; secondary cartilaginous joint, which is also known as symphysis. And the third classification of joint is synovial joint, which include ball and socket joint, cellular joint, condylar joint, ellipsoid joint, hinge joint, pivot joint and plane joint. Next classification is based upon the function. And according to functional classification, joints are of three types: synarthrosis, that is a most immovable joint, like for example fibrous joint. Second is amphiarthrosis, that is slightly movable joint, for example like cartilaginous joint. Next is diarthrosis. These joints are like synovial joint and are the freely movable joint. Next classification is on the basis of reason. And according to these, joints are of three types: skull type, that is immovable; vertebral type, that is slightly movable; limb type, that is freely movable. Next is according to the number of articulating bone. First is simple joint. In simple joint, only two bones articulate with each other. For example, interphalangeal joint. Next is compound joint. More than two bones articulate within one capsule. For example, elbow or wrist. Next is complex joint, when joint cavity is divided by an intra-articular disc. For example, temporomandibular joint. Thank you.